I think that the most impressive thing that hit me initially was Dr. Moy's hand and eye coordination. That special talent we can't give to somebody. That has to be innate. The way we operate, the procedures that we do, are done so carefully. We spend that little extra time to make sure that the tissue is properly handled, that the planes that we open, we have the ability to close again, and that tissue just comes back together naturally.
Coming up next, one of the most profound discoveries of the 20th century. How will the miracles of modern medicine lead us into the next millennium? Join us when we go behind the scenes inside the OR.
Before I knew it, I was just waking up and it was done.
I went to the gym about 5 days later.
Dr. Moy made me feel that we were going to do this together.
Hi, I'm Dr. Richard Moy. Are you or someone near to you suffering from foot pain caused by bunions? If so, you owe it to them and you owe it to yourself to consider an examination. In the past, bunion surgery was often more painful than the bunions themselves, but not anymore. Using advanced surgical techniques, I've developed a procedure that significantly reduces the pain and recovery time traditionally associated with bunion surgery. In the next 30 minutes, I'll show you how.
In my business, we sell tile and stone and granite to contractors, builders, and designers, and my job requires me to be on my feet at least 10 hours a day, walking on hard surfaces, carrying samples, going out to job sites under new construction. And my concerns about having bunion surgery was the downtime that it would take for me to recover from it. It amazes me that I can wear heels now much more comfortably than I ever could before walking on hard surfaces for 10 hours a day. I experience no pain at all like I used to in the past before bunion surgery.
Well, mainly it was the time that I was going to take to recover. I felt that I couldn't afford to miss work for once. The doctor I consulted with prior told me it would be like 6 weeks to 2 months, and I certainly couldn't afford that. I'm also very active, and I spend a lot of time training and running and playing basketball, and I'm just an active guy, and my feet are very important, in that aspect of my life, and I didn't think that I would be able to continue to do that unless I had had my feet corrected. As a doctor, Rich Moy has been terrific. His follow-up has been very precise. I recommend Rich and have to other people, and from what I understand, their surgeries have been very successful as well.
After years of having a lot of pain in my feet and being very afraid to actually go through with having any kind of surgery, I had always heard a lot of really horrible stories about the pain that you experience, I've had a lot of fear about that, being not able to walk and being out of commission for weeks at a time. And after talking to Dr. Moy, he's assured me that with this type of foot surgery and this type of surgery that he does, you can choose what you want. You can choose between being completely wide awake with just a local or being put to sleep, however you want to do it, what you're comfortable with. And since there is no pain involved with this surgery, you wake up not feeling sick to your stomach and not feeling really disoriented and in a lot of pain, which is a really great relief and comfort for me, and another reason why I've decided to go ahead and have surgery.
Hi, Andrea. How are you doing today?
Hi, Dr. Moy. How are you?
Good.
Good to see you.
I know you're interested in bunion surgery, so what I'd like to do today is show you your x-rays and show you where your bunion deformity lies. Right here we have the first metatarsal, and what you see here is an enlargement of bone on the side of your foot. And that's where your bunion is actually causing you pain. This view over here of your right foot is on an angled view called the medial oblique, and that shows you the dorsal medial prominence, or the prominence that is above and to the side of your foot. This is a side view of your foot. And right here is where the problem lies. And what we plan to do is create an osteotomy through your foot like this to allow this segment of bone to slide over. And you can see this segment of bone is cut in this direction and slid over, and a screw's placed in it. This will all be smoothed off and polished off, but that's left there to show you exactly how the bone's cut and how the screw's placed into the bone. This is a person's foot that just had surgery about 6 weeks ago. And right here, again, is where the bunion lies, and you can see the soft tissue swelling that's occurring around here, okay? What we do is we went in, we removed this small segment of bone here, we shifted this segment of bone over in this direction like this, and therefore we're allowed to realign these sesamoid bones. The sesamoid bones are sitting right here and right here right now. And what you can see in the postoperative view is that the sesamoid bones are realigned right here, right where they should be, and that the bone is in nice alignment. And you can see how the angulation or the distance now between this bone and this bone is a lot less. And the toe is in nice straight alignment with the first metatarsal. Looking at this other x-ray here on the medial oblique view where I told you that the bump is not only sticking out to the side but up, you can see how that's been completely reduced. And you see this bone here, right here, is now in line with about this point here, so the bone is no longer sticking past this red line. Also, in this particular view over here, we see how the metatarsal is here, and this actual bone has been dropped down slightly right here and lowered just ever so slightly to create increased range of motion for this patient in this direction.
I heard from several people that bunion surgery is extremely painful and they weren't able to walk for months. Is that true?
When you have a fractured bone in your body, the pain is a result of the two ends of the bone moving. We have created a quad correctional bunion procedure that realigns the great toe joint in 4 different directions. And then we use a screw that allows for tight compression. In this case, there is no movement and your body does not tell you that your foot is fractured.
How long will the surgery last and how long before the numbness wears off?
Well, the procedure will only last right around an hour. And then you'll go home, relax, keep your foot up, and the numbness will wear off in about 8 to 12 hours.
Will I need a cast and crutches after the surgery?
Well, after the surgery, no, you won't have to use any crutches or a cast because the bone is so tightly compressed together that you can actually put pressure on it without moving it at all.
I found that I had no problem walking. It didn't stop me from going out and doing the things that I normally do.
Well, I've had foot pain for years. What it felt like was a burning kind of dull ache